Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Types of calcium channels. Calcium channels are divided into, we have three types of calcium channels. One L type of calcium channels, T type of calcium channels, and N type of calcium channels. So first, what is L type of calcium channels? L type of calcium channels is nothing but long type of calcium channels. These L type of calcium channels are present in they are actually present in cardiovascular system. They are present in uterus and lungs. They are also present in blood vessels also. So the drugs which block this L type of calcium channels are calcium channel blockers will block this L type of calcium channels. So L type is blocked by calcium channel blockers. Then we have T type of calcium channels, T for transient type of calcium channels. These transient type of calcium channels are present in brain. So thus they are used in absence seizures. Actually, the T type of calcium channels are blocked by the drugs like they are blocked by they are blocked by ethosuximide, and also they can be blocked by valproate, and also the drug trimethadione will block the T type of calcium channel. The drug ethosuximide is actually used, or actually it is the drug of choice for absence seizures. So their action is present in the brain. So this is T type of calcium channels. Then we also have N type of calcium channels, which N for stands for neuronal type of calcium channels. This neuronal type of calcium channels is present in central nervous system, and these neuronal type of calcium channels are blocked by drug called as conotoxins will block this N type of calcium channels.
thank you and thank you for watching.